Sir, your screen is visible now. Okay, I guess we can start now. Good morning to all. Welcome back to the fifth day of 5 days workshop on applied data science for healthcare. So let me give you a brief agenda for today's sessions. We have before lunch we have two sessions. One is on recent trends and current challenges in healthcare. Followed by that, we'll be having future of data science in healthcare. Post lunch, we'll be having feedback and evaluation. Followed by that, we'll be having valedictory session, and then we will conclude the workshop. So let's start with our first session. Let me introduce to our esteemed speaker, Dr. Manish Kurekar sir, for today's workshop. Dr. Manish Kurekar sir is highly accomplished individual with an impressive academic background and extensive professional experience that spans across academia and industry. Sir holds a bachelor's degree from VNIT Nagpur, master's from IIT Bombay, and PhD from VNIT Nagpur. They have nearly 8 years of experience as project manager in Persistent Systems Limited. He has also contributed to significantly to research and development during their time as a research staff member at IBM India Research Lab. Additionally, Dr. Manish Kurekar sir has practical industry experience as a software engineer at Texas Instruments. Currently, sir is serving as an associate professor at VNIT Nagpur. Sir's research areas encompass theoretical computer science, system biology, machine learning. Their contribution to these fields have been published in reputed journals and presented at international conferences. We are fortunate to have Dr. Manish Kurekar sir with us today, as their vast experience, deep knowledge, and research expertise will undoubtedly enrich our workshop and provide valuable insight to the participants in the field of healthcare and data science. Please join me in extending warm welcome to Dr. Manish Kurekar sir. Sir, we are eagerly looking forward for your enlightening session. Welcome to this workshop, sir. Over to you, sir. Now you can take the session. Sir, can you hear me? Okay, sir. Please wait. Just a second, sir.
Okay, are you able to hear me?
Yes, sir. I can hear you now.
Okay. So, thank you for a very, very warm introduction. And I will I will mute my video because it consumes a lot of bandwidth, and then there will be patchy things at times. So,
Sure, sir.
I am very much fortunate here to address you all, and I request you all to not feel shy and to ask questions whenever you feel like, and please don't hesitate. Please stop me wherever the need be. Okay, so now. We will focus on the topic for today, that is the recent trends and current challenges in healthcare. Okay, and the more focus is on CS and IT. IT is information technology. CS stands for computer science. So the more focus here is on CS and IT interventions, like how these tools and technologies and automation that is happening in this area is making available. The more focus is not on something like robotics or things that device manufacturers use. The major focus is on something that the challenges I'm going to talk about are something that can be done on a PC, on in your lab, with students. So we are going to focus, our focus will be mainly on those kind of things. Okay. So why and why IT matters now, especially for biology. Earlier, it was used to be thought that biology has nothing to do with IT or mathematics or something like that. But now we are seeing massive amounts of data. So data is being collected for text, numerical, as well as image-based data. So a lot of data is being collected. There are several levels of automation that have happened, and because of this automation, autonomous robots or autonomous entities need to take a decision, or at least raise an alarm if there is something that is not happening correctly. Then there is now in the medical community also there is an openness for statistics and AI ML, which was not there, say, 20, 25 years back. Now everyone is seeing that there is a lot of value that the AI ML techniques, that is artificial intelligence and machine learning techniques, are bringing to medicine. And because of this, there is a lot of activity that is happening in this area. So, what has it allowed in the last few years, the AI ML interventions, is basically now there is a targeting of exact cells, the cells that are gone rogue, say in terms of cancerous cells or in terms of, say, elements like, for example, the pancreatic cells or the liver cells. So you basically target those exact cells, and so there is a precision in targeting those cells. Okay. Even nowadays, if you see asthma, for example, was one of the most difficult things earlier to control. And asthma happens to be like quite prevalent, like 2 to 3% of the population suffers from asthma. And now you have precision medicines which act on exact those cells. Earlier, the medicines used to act on cells of heart and lungs and even pancreas and kidneys and basically the digestive system. And the life of an asthmatic patient was very, very difficult. You must have seen in earlier movies, like asthma was a crippling disease, like your way of living was totally disturbed. But now we are having targeted exact cells, the medicines which are targeted to those cells which affect asthma, which basically are in the lining on the respiratory pipe. And when those are targeted, the other systems don't are not affected. The medicine required is a low dose. It is targeted, so there are less side effects, so on. So we are seeing this targeting of exact cells. There are personalized medicines, so a person may have n number of different things. So a diabetic patient, for example, may have kidney disease as well, or a liver disease as well. And so there are medicines which are specific to those, or they might be allergic to something. So this is currently the era is moving towards personalized medicine. And tomorrow, what we are going to see is like based on the DNA profile itself, you can figure out what kind of personalized medicine will work for these patients. The next thing is the storage and retrieval of data. Like, for example, our earlier people did not have a history of their medical records. Not only that, medical records, the history of their whole body. Like, for example, some people might have a heart rate of normal heart rate of 90. whereas some people might have it as 60. Average is 72, that we all know. But depending on your body profile, depending on your the way you live, the way you lead life, you might have different levels, and which might be normal for you. So, but then how do you do baselining? What were you in the young age? What was the when you are at the peak of your health, say around 18, 19, 20 years of age? What was the baselining that you have? Right? That is currently unknown for most of the people. But now with this advances in devices and storage and retrieval capabilities, okay. So how do you store so much of data? How much amount of data you should store? What kind of data you should store? Right? So a lot of research is happening, and there are many strategies which have been developed, and not only that, there are many storage and retrieval currently being developed for storing your X-rays and different kinds of sonographies and other things, so that you can have a history which can be presented to your medical practitioner. And most of this is encrypted so that nobody else can have an access to the data, so on, right? And so because it is a very sensitive data, and so storage and retrieval is another thing. The next thing is simulation modeling. So you can have, like, you have digital twin kind of technologies now. So you can simulate a human being or an organ or a disease spread or a society in computer, and then run a lot of what if scenarios. You can see, you can tell what will happen if you provide this drug. So we recently saw a lot of simulation modeling experiments being in the public domain for this COVID disease spread, right? So a lot of models used to predict how many patients will be there, how many hospitalizations will be there,